So good evening once again. Hello, this is Aliyah. Welcome to this 18 hour. This is Asia eHealth Information Network's bi-monthly webinar series where we talk about various topics on eHealth useful for your work as a health IT professional. We're glad that we're meeting once again for some of our members here. And for those who are new in this webinar, we'd love to have you join us more often, twice a month, here at our 18 hour. 18 Secretariat is at the National Telehealth Center in the University of the Philippines and has its satellite secretariat at the Thai Health Standards Development Center in Thailand. Today we're talking about the Momentum Treat framework and some issues that communities have to deal with in terms of large-scale implementation of telehealth and telecare. We've got a lot of questions revolving around on the right formula that will lead to successful scale-up, what are the challenges it imposes, and how can they be addressed. So let's get started. Some things to remember before our session, our platform, how to participate, our program, and the email feedback. We're now using Cisco WebEx Event Center, and if you're having trouble hearing us or participating in this session, just log out and rejoin through the link immediately. Our meeting room number is 860-347-152, and our password is Brussels123. Your mic will be mute during the meeting, and we suggest that you participate by sending your feedback, chatting your questions, and poll answers through the right side of your screen. Let us know your response to the session without having to unmute yourself, so just click the dialogue icon with a check mark on your left and tell us your yes or no, your too fast or too slow response, your applause, and your laughter. You can also send a message to the host or to the panelists in the chat box beside the participant button. And personally, I strongly encourage you to chat your thoughts and insights here so that we can echo it to our meeting room. Because you cannot chat to all participants, as this is a default feature of the Cisco WebEx Meeting Center, to bring order in our chat room. The panelist or the speaker have the only option to chat to all attendees. And lastly, pose your questions by selecting the Q&A box. This is at the bottom right of your screen. And in this meeting, all questions should be addressed to the host. And as host, that's me, I will consolidate all the questions and ask this to our speaker later. We also have our polling option. So answer the poll, which will appear in the right panel of your screen. And on my signal, the poll will be opened, and you'll have to key in your answers. The results of the poll will be released right after the session. Now we're done on how to participate. Let's go to the program details. The session will run for 45 minutes to 1 hour, and we request you to send your queries to our Q&A box to separate the chat and the questions inside the meeting room. And lastly, after this session, please check your emails, as we will be following up with your evaluation of this meeting. So that's it. 4 things to remember to our session: the platform, how to participate, the program, and the email feedback. We're so privileged to have our speaker for this evening, Mr. Marc Lange, who has a master's degree in law and option business and European law. He is acting as Secretary General of European Health Telematics Association since December 2013 and managing European projects for the public sector since 1992. He has a long experience in supporting EU member states and the European Commission in coordinating the deployment of their national projects, facilitating sharing good practices in a multidisciplinary environment, observing and analyzing and synthesizing the progress of this knowledge-sharing process, and contributing to policy definition for deploying innovative ICT services for the healthcare sector in particular. Thanks to this experience and to his position in EHTEL, Marc Lange has a global understanding of the state of affairs in eHealth in Europe and beyond. So the introduction is just right for us to increase our attendees for this evening. Without further ado, I'm now transferring the presenter controls to Mr. Marc Lange for our topic, Scaling Up Telemedicine, the Momentum Treat Framework. Good evening. Marc Lange from the Philippines, and I know it's an afternoon there in Brussels.
Good evening, Alia. Good evening, everyone. It's really an honor to be with you tonight. Well, for me, it's the afternoon, but still, it's really an honor. It's also an honor to see that even the password for this conference includes the word Brussels. So, very pleased to see all the signal of your interest in what we are doing here in Brussels and in Europe in general. Let me now share my screen with you, and I will start immediately. Yeah, does it work now? Yes, it works. That's wonderful. Okay. So very briefly, first, you have seen that I have a master's degree in law, but I will not speak about legislation. I will not speak about law. Actually, law is my background, but since the beginning of my career, I have been working in the IT domain, but in the IT domain for the public sector, and that's really what I will be speaking today, and in particular, the IT domain in the context of healthcare. Now, briefly about. Not who am I, but which organization do I represent. EHTEL stands for European Health Telematics. Those who are a bit familiar with, or even unfamiliar with the word telematics may recognize that EHTEL is actually a quite old organization because we have been invented or created 16 years ago, and at that time the word eHealth that we are using everywhere across the world was not yet invented, and even the word e-government was not yet invented. So this is just an indication on how old the organization is, and I am managing it since now 12 years, so I have quite a long history in the field of eHealth. What is this association? What is the mission of this association? We are working as a forum. Our mission is really to be a forum for who? For all those working on eHealth. Meaning that for all those means in fact whatever the group, whatever the profile, whatever the mission they have, whatever the role they have in the society, being either a public authority or a health insurer, or what we call a payer, or being a user as a health professional, or as a patient, as a citizen, or being from the industry side, from the IT or the pharma industry. We are offering to all these organizations a forum where they can learn from others, exchange good practice, exchange experimentation, exchange experience on deploying eHealth matters. Why are we doing this? Simply for the simple reason that we do believe in our association, and now everyone in Europe, we do believe that eHealth will not happen without the support, without the contribution, without the engagement, the involvement of everyone, meaning of the public authorities, the payers, the users, and the industry. Why? Because eHealth is perceived, is seen as so disruptive, so important for the purpose of healthcare, in the context of healthcare, that everyone needs to be part of it. I'm using the term eHealth. We have also been using other terms, telehealth, telemedicine. Let's spend 2 minutes only on this, just some kind of terminology warnings. And also today you are hearing about, very sorry, the telephone line is ringing now, and I will try not to be disturbed with this, but you will have to wait. Very sorry for this. So, few words on the terminology. eHealth, telehealth, telemedicine, mHealth. I'm not willing to spend too much time on this, and all this is nearly about the same. All this is about, we can make a subtle distinction, but that's not important in this context. All this is about using ICT for the purpose of healthcare, But in fact, even this, using ICD for the purpose of healthcare is even the wrong way of saying things, because that is putting then the priority to ICT. No, eHealth, telehealth, telemedicine is about healthcare with the support of ICT for communicating data, for communicating between the different actors. We also consider, therefore, that mHealth, meaning eHealth with, or health apps, eHealth with mobile phones, as soon as this is recommended, as soon as it's being used by doctors or by hospitals, then, or in the context of a hospital, then this is eHealth, a particular eHealth, but not very different from eHealth in general. And that is where we need to be careful, where we hear about health apps, or we hear about mHealth in a context of, yes, health apps, but of health applications which are downloaded by citizens, by patients, but on their own initiative without any clinical recommendation, then we do not consider this as part of eHealth, but in Europe we consider this as part of the well-being, of a well-being environment. The difference on this is simply that this mHealth in a well-being environment does not how to say that, does not touch, does not engage the responsibility, the liability of the clinicians, of the hospitals, and of all those who are delivering care. This is simply something that's being used under the responsibility of the citizens at their own initiative. And that makes a big difference. So for the moment, when I will be discussing in this presentation or using the words eHealth, let's consider this is equal to eHealth, telehealth, telemedicine, or mHealth when recommended by the clinicians. Now, why is eHealth important? This is a small animation that shows that in Europe, and actually it is now, I will not say that this is the same in the Philippines, but you see a situation like this one also in Japan and in China. We are facing a major, and we are about to face a major challenge when you see the structure of the population that we have in Europe. And you can see that within the coming 30 years, the population, which was mainly a young population in Europe, will become to a larger part an old population. That's what we call the aging Europe, and that is creating quite some challenges for the healthcare system. Why? Because an aging population will cost more for the healthcare system. And an important element, therefore, is that because of that aging population, but also because of the healthcare, of the technology in healthcare, medical devices, medications, treatment is also increasing. The healthcare system in Europe is about to not to be able to face or is about to have major problems. Aging population means increased demand for healthcare, and an increased demand of healthcare in the context of increased healthcare costs. You can easily understand the challenge that will be creating in Europe. And that's why one of the major strategic acts for the transformation, for the modernization of the healthcare system in Europe, and probably in the industrial world, because we have also observed that drawing and that movement also in the United States and Canada. We are the strategy for the transformation of the modernization of the healthcare system is to transfer as much as possible care from an acute environment to a residential care environment, or even to a home care environment, using eHealth, using telehealth, using mobile mHealth. And why this strategic orientation? Because there is a kind of, not yet an evidence, but there is a common understanding, a common acknowledgement that healthcare, when delivered in residential care, or in GP practice, or in home care, will cost less than in an acute environment, and in the same time will improve the quality of life of the patient, because we all know that hospital is certainly not the right or the best place to stay. So that is important, necessary. We in Europe are obliged to transform, to modernize significantly the healthcare system, and that is where telehealth, eHealth, as a strategic role to play. Here, this is a small drawing that's described in technological terms what is needed to implement the slide that I was using just before, to implement this movement from this red arrow going from the bottom on the right hand side to the top of the left hand side. Implementing telemonitoring systems at home, or health coaching, or so in fact including home in the healthcare process as a place for healthcare implies equipping home with different telemonitoring devices and with gateways and with an infrastructure that helps these devices to be connected to what? To a telemedicine center where everything is being managed, everything is being, all alarms, all are filtered, where the triage is being taken care of before and when the necessary actions are being initiated to escalate, in case of there is a problem, to escalate an action on the side of the healthcare system. So that is the way to provide to include care in the clinic, in the healthcare process. To include home in the healthcare process, and this is what we mean by the fact when we say that we need to redesign services, we need to redesign clinical care process with telehealth in order to modernize the healthcare systems. Now, the problem here is that with the technology, and with this I will be nearly closing my introduction. With the technology, we have faced for years a common mistakes. If we put the focus of our work and of our thinking on the technology without touching the healthcare system, or without touching the existing care process, then very often we are arriving to something that doesn't work. And the cartoon here is really, which is of a Belgian origin, is really illustrating this illustrating this equation. New technology plus an old system or an unchanged system delivers a new old system, meaning that can work, but will this offer the expected benefit, and in particular the expected benefit from an economic and organizational point of view? That will not be the case if we only implement the technology and do not take care of transforming the system, the healthcare system. And that's the message of this slide, and that's the message. That's the reason why we need to work in parallel with the technology and the healthcare system. There has been in Europe a number of studies, and probably across the world, a number of studies about how telehealth, how eHealth can improve healthcare. There has been a number of scientific studies, and one of the projects that EHTEL has been part of some years ago, called Renewing Health, has been working on that with a number of countries and regions of Europe. Developing or applying scientific methodologies to analyze how telehealth delivers benefits. Briefly, the main findings are the following. First of all, from a clinical point of view, from a clinical effectiveness point of view, and from a safety point of view, using eHealth, using telehealth, helps to provide good quality care, or at least as safe and efficient care as a regular service. So meaning that if implemented properly, telehealth, eHealth and telehealth does not harm or does not harm the patient and does not reduce the quality of the care. Of course, if implemented properly. In the same time, there is now scientific evidence that telehealth, eHealth has a positive impact on patient satisfaction and their quality of life, in particular when related to healthcare. Now, the scientific results are not completely clear in the sense that depending from the scientific method that has been applied, SF-36, which is a standard questionnaire, or SUTAC, which is another type of technique to collect feedback, they do not provide exactly the same results, but these results do not diverge significantly. The impact on patient satisfaction is positive. But of course, there is some open issues still. At least Renewing Health is closed with open issues. Renewing Health has tried to assess the economic impact, has tried to assess how far we can reduce the cost of healthcare, of a healthcare process, or gain efficiency in the organization using the technology. But Renewing Health has come to non-conclusive answers and has identified some reasons why some answers are not conclusive. Certainly, the size of the market is an element, meaning that there is not enough. The cost of the medical device, of the telemonitoring systems, the cost of the infrastructure to be put in place is still too high because the market is still too small, and by a small market and high cost, the economic efficiency of telehealth is of course being damaged. And there are a number of other arguments, of other explanations why the economic efficiency of telehealth has not been proven yet. I will not go too far into the details now. You have the slides and you will be able to go through them later on, and we will also be able to go and visit the website of the project if you are interested in this. I would like to pass to move quickly now on momentum by saying that, before going on momentum still, by saying that Renewing Health is now being followed up by another project, which is called United for Health, which has exactly the ambition to address the open issues of Renewing Health, meaning to assess the impact of telehealth on the organizations, on the organization of healthcare, of the healthcare delivery process, on the efficiency of this organization, and on the efficiency gains from an economic point of view and from a resource point of view that can be obtained using telehealth. It's a big project, as you can see with the map of Europe. There is a number of regions, a large number of regions, not all countries, but a large number of regions from 14 different countries which are involved in this project, as well as a number support organizations that you see the logo here on the site. No point to go too much in the detail. Again, to know more on this, you can have access. You can have a look on the website of United for Health. Use Google to find it. It will be easy. But you can also visit YouTube. There is a special channel on both United for Health and Renewing Health, where you can watch some speech, some conferences which have been given on this project. So that's for you to know to have further on this. This is simply providing you with the big picture of where we are with telehealth, of how we see telehealth as an instrument for transformation of the healthcare system. So a very ambitious objective, and where we are in assessing impact and in developing evidence. And now it's the right time to move to really the scope of this presentation, and to move to another project that analyzing how to scale, how to deploy on a large-scale basis momentum. What is important here, before entering into the content, what is important here is to observe the fact that with projects like Renewing Health United for Health, like Momentum, and some other projects, we start now in Europe to have tools, to have experience, to have tools to help preparing, scaling, or organizing scaling of telehealth, to help assessing impact of telehealth from a clinical perspective, from an economic perspective, to help developing business models, to help developing cost and benefit analysis, and to help organizing large-scale deployment. And that's very important that these tools start to emerge and are available. They still need to be better known, but it's important to know that they are available, because that will help any e-health professionals to take advantage of them, to get the substance, the essence of the good practices of all the experience that has been acquired so far in deploying telehealth, and to take advantage of this to deploy their own projects, and deploy their own systems. That's important to understand this. Tools and methods start to be available now, at least in Europe, and based on European experimentation. Now, Momentum, the project itself. It's a project that has been running over nearly 3 years. It is now finished, and that project has been operated by 20 organizations from more than 10, from 12 different countries of Europe, and from different organizations representing health professionals, representing payers, representing the industry. So again, this multi-stakeholder environment. So while it was a rather small project in comparison with the other project I've been referring to, while it was a small project in terms of the budget and in terms of the people being involved, it was covering a large spectrum of organizations and of countries. And to position exactly, to be sure to understand what is the problem Momentum is addressing, I would like to use this this image, and all those who which is clearly inspired from London, but I'm sure that in metro, in different places everywhere, you may heard this concept of mind the gap. Including in Asia. So in fact, mind the gap. Why? Because in fact we have observed that since 10 or even 20 years, there's always all those e-health professionals who have launched, initiated a project on telehealth, on telemedicine, on e-health in Europe. Most of them have been facing a problem moving from the pilot environment to the routine care environment. And that's really, that point, that challenge, that problem, that gap, that Momentum is willing to address. How to move from pilot to routine. This drawing here that you see now is another way to illustrate, or is a way to illustrate what are the problems. When you are piloting a service in a closed environment, in a lab environment, or in a small scale environment with a small number of patients which have been volunteering to join the project, that's what we call the pilot site. When you want to go from that closed laboratory environment to real life, because the next steps, small scale deployment or even large scale deployment, is really putting the piloted service into routine care service, into real life. There are a number of challenges to face. The rules for deployment, the rules to pay attention to, they are not the same, and that's very important. And a lot of people have learned hard that lesson, as soon as moving out of, as trying to go to real life, they were facing problems, constraints, limitations, requirements that they were not prepared to face. And that's where Momentum is trying to, is working on. Momentum has in fact developed a set of guidelines, what we call a blueprint for deploying telemedicine in real life, so in routine care. And let's summarize that this blueprint has been developed by doers, so by eHealth professionals, for doers, for eHealth professionals. And that's important to keep in mind. So this is the outcome of good practices, of lessons learned in the field. Momentum has organized the project along 4 teams, 4 domains: strategy and management and project management, organization, implementation and change management, second team; third team, legal, regulatory and security aspects of the deployment; and last but not least, the fourth team, technical aspects and market relation aspects. And this has been the 4 domains of activities that we have been analyzing. And the outcome of this work has been is summarized by this shamrock drawing, by this shamrock model. Momentum has in fact identified 18 critical success factors. 18 factors which are critical for success. 18 factors that every doers, every eHealth professionals willing to go to real life with their project needs to pay attention to in order to maximize chance to be successful. 18 success factors which have been organized, well, which have been taken out of the 4 domains I illustrated, and this is the color of the spots that you see on the screen, but also 18 success factors that have been also organized in some common topics. The context in which a doer wants to deploy a piloted service. That context is an element, is a domain, and here we have 2 critical success factors, and I will briefly touch some of them in another slide. So 4 domains. The context is an important element. The people domain is a very important topic. We don't deploy without the people, but we also don't deploy services without a plan, and without a plan at different level, without a plan from a legal point of view, but also from a business point of view, from a technology point of view, and from a transformation, from a change management point of view. And we do not, of course, deploy the service without having, without running the plan, without working on the deployment itself, and then we have a number of different critical success factors that you will find in this domain. But let me remind you that Momentum here does not intend to provide an answer on the effectiveness or the scientific value on the impact of telemedicine. So Momentum start from the assumption that the telemedicine service you have put in, you are willing to, or the doer is willing to deploy, that the service has gathered the necessary scientific evidence, and that the IT system that is to be put in place exists and is being tested and is robust enough for scaling. So we start from these 2 assumptions. If these 2 assumptions are not verified, then my message is then don't try to scale up already. Please go back to the lab. Please work on these 2 assumptions, and only initiate the process of deployment, of scaling, as soon as these assumptions are sufficiently verified. 18 critical success factors, and here I will present them not on the domain context, people, people plan and run, but on the domain they were on the four initial domain of investigation that I presented. The first domain was strategy and management, and here four critical success factors which belongs to that domain. Very first, we need to, and that was about the context, if you remember. Very first critical success factors to pay attention to. Please verify or pay attention on the fact that on the cultural readiness on the environment where you want to deploy the telemedicine service. Which culture? What do we mean by cultural and readiness? Readiness, actually, an example of this is readiness for healthcare professionals to share data, to exchange data between them. This is, of course, there is no telehealth, there is no e-health services that can be rolled out in real life if clinicians, if doctors, if health professionals and nurses are not ready to work together and are not ready to share data. Of course, in a wise environment, of course, taking into account privacy, taking into account safety, taking into account a number of different elements, but that cultural readiness is an essential component. Another element which is about really about people, another critical success factors is the leadership. There will be no deployment without champions, one champion or several champions, and the more we listen to people, the more we understand that if a large-scale deployment of a service does not often work with one single champion, but with a team of champions, and even sometimes you have champions who are changing. But champion is needed because champion will not, without champion, nothing will happen really. Other element which is other critical success factors which is about again what was it? Let me check this. In which domain was it the compelling need? Of course, yes, it was still in the context. It was still in the context domain. Part of the context, of the context of your deployment, you need to be sure that, and that's an important critical success factor. You need to be sure that there is a consensus between within the group you work with, within the stakeholders you work with, the hospital managers, the GPs, the doctors, the nurses, and the patients, or the society, or the region and the environment where you are. You need to have a consensus on the fact that telemedicine has advantages, on the fact that telemedicine is a solution that is acceptable, and that it has advantages. If there are people who are still hesitating, who are still not supporting the use of telemedicine in the context of healthcare, or telemedicine, or telehealth, or eHealth, then you need to work on that before scaling, before working on the scaling. Fourth critical success factors in this domain, we need, of course, to pay attention to the resource for the needed for the deployment, so meaning the resource for the project part of it. You need resources for the operation of the service, but you also need to aggregate resources for the deployment, and it has been observed that resources often or always come from different places, and that can be human resources, that can be financial resources, that can be time resources, that can be several different resources. They need to be pulled together, they need to be aggregated according to the plan so that they are available for the rollout. Let's try to visit quickly the other critical success factors. This belongs to mainly to change management, organization and management, and this fifth critical success factors, which is about really about planning. You need to identify who is the primary client, or who is the primary group of clients. That can be health professionals, that can be payers, that can be patients, but by primary client here, we mean the people who have the key in hand for a successful rollout. Without having them having their need being fulfilled, they will not go. They will not support the rollout, and that will be a blocking factor. Just to give an example, you may not have noted, but Israel was, we had one organization coming from Israel, and Israel is a very advanced country or mature country with, or there are organizations in Israel which are very mature in terms of using eHealth, and in that organization, they always say that each time they are creating a new service or a new version or a new feature on the eHealth systems, they are always asking themselves, is there something for my doctors? Because they observed that doctors are their primary clients. So just to illustrate what we mean by this. Now, other critical success factors, very important from an organization change point of view. The healthcare professionals and the decision makers need to be involved in the deployments from the beginning. They need to, this is a key condition for buying, for having their support, globally speaking. They need to be involved in the design of the project, they need to be involved in the preparation of the plan for rollouts, and they need to be involved in the evaluation of the service. Because they are users, because they're essential in the deployment and in the operation of the service itself. Other element very important, another critical success factors, the seventh one, the critical success factors very important is the definition, the preparation and implementation of a business plan. The business plan mean here, this is not about business from a industrial point of view, from a company, private company point of view. This is about identifying what we call the value proposition, what is the advantage, what is the benefit that can be offered by the service, who are those organizations, those people who will benefit from them, what is the cost, what can be the revenue for the operation of the service, is reimbursements by the healthcare healthcare system or by the social security system, is this reimbursements foreseen? Can the patient, can the employer, can the hospitals also financially contribute to the financing of the operation of the project, of the service? That is all these elements that needs to be paid attention to. And of course, another plan, that's the 8 critical success factors. Another plan that is critical is a plan for managing the change, because you will be moving from a point A where you are providing care using providing care in a usual way, and what you are proposing is to provide care in a different way using telehealth. And then you need to help, you need to make a plan to organize that transformation, to ensure that there is a necessary training, that there is necessary communication activities, that the organization for supporting the transformation is in place, that staff have been assigned the responsibility to organize the change and to provide and to support that change, and so on and so forth. So that is the element of change management plan. And of course, the 9 critical success factors is an obvious element, but it is important to mention it. When designing the service, when designing the rollout, when designing the plan, the business plan, the change management plan, and when deploying the service, you need to always put the patient in the center of the service. That is, at least from a European perspective. This may be, again, it's perhaps important here to introduce a difference. All this is, of course, said from a European perspective. And for instance, one element that I've observed in the few countries I've visited in Asia, or I've heard about in Asia, while in Europe the relationship between the doctor, between the patient, between the doctor and the patient, between the nurse and the patient is very important, and it is really a one-to-one relationship between two individuals. The importance of this is probably less important or less frequent at least as far as I'm aware of, in Asia, or in some country, in the Asian countries that I'm aware of. So, of course, here these critical success factors, you when planning to use them in your own domain, you will of course have to adapt them to your own environment. Now, time is running, and I need now to leave room for question and answer. So, other critical success factors from a legal point of view, that's of course very important. The service that you are putting in place has to be legal, and this has to be assessed at a very early stage. And if it is not perceived as legal, then everything needs to be, the conditions for making it legal needs to be identified. Very important, and I will go fast, a bit more fast here. Very important here is that we have observed that dealing with security, dealing with legal issues is so complex when rolling out e-health services, that it is important to have ready a team of experts which have the necessary expertise on legal and security matters, and which can provide you the guidelines that exist in that field. Last but not least, critical success factors belonging to the domain of technology, and to the domain of the market. Market is very important, because without the market, you will not be able to create, and without a large market, you will not be able to buy cheap technology in the field, and you will not be able then to have a good return on investment with the telehealth, or to develop or to demonstrate the economic efficiency of telehealth. So that's an important element, an important domain to pay attention to, and that implies that infrastructure needs to be in place. And in Europe, there's a lot of work being done to develop, to deploy an IT infrastructure, so broadband internet connections, but also to develop e-health infrastructure with electronic health records, with electronic identification mechanism, with data repositories, data dictionaries for healthcare, and so on. There's a number of there's a number of building blocks for infrastructure that are being deployed, and this is very important to take for a telehealth service to be deployed on a large scale, to take advantage of the infrastructure, because this is reducing costs, and in the same time, this is enabling interoperability with future interoperability of the service, of the technology being used, and of the service. Of course, technology needs to be user-friendly. That's an essential element, because technology is secondary. Healthcare is primary in this context. Very important to pay attention to the need to monitor the service in order to ensure that it's running smoothly. It's of primary importance, because you cannot ask a doctor or cannot ask a nurse to stop providing care because the technology fails. So that's important to have a good monitoring systems. That's of course, very important to maintain, to create, to organize a procurement process, and a fair and a good procurement process with the industry, in order to get the technology that you want, in order to get, and also in order to get, technology is always evolving, so in order to be able also to evolve with the technology. And last but not least, and I will stop the list of success factors here. Last but not least, you need to pay attention to the fact that when choosing a technology, it has to be ready to scale. It has to have the potential to scale. If it doesn't scale, then you will end up with something that cannot be deployed on a large-scale basis. And don't dream, you cannot deploy a beautiful technology that is only provided by one single small company. You cannot deploy it on a large scale. You will not get the buying of the decision makers, of the politicians, or of any other one. So pay attention on that, from that element. Now, this list of success factors, they are here, they are there. They are available on a document that you can find on the website, and this list can be developed, so can be analyzed. In addition to that, we have identified a number of indicators that helps to check whether you are you are paying enough attention on these critical success factors. But it is important to understand and that's the methodology that we have been developing, we have been putting in place for working with these critical success factors. You need to pay attention on the fact that these critical success factors, you need to work with them, with all the stakeholders, with all those people who are part of the team, doctors, nurses, hospital managers, decision makers, politicians, perhaps municipalities in some cases. You need to work with all of them, to involve all of them in the process, and you need to work with them on these critical success factors. And therefore, we have a methodology, a collective methodology that has been developed based on based on questionnaires using these indicators, where you are inviting everyone, all your actors, or the representative of all your actors, where you're asking them their opinion about how far is the project complying or not complying with the different indicators that we have identified using this kind of agree-disagree scale. And by obtaining questions, by obtaining answers from different stakeholders on all these indicators, we can create, or you can create, organize a workshop with all these actors in order to compare the results, contrast the results, and identify where are the problems. And by identifying where are the problems, meaning where are the problems, how can you identify them? You will identify them then by seeing that a number of people or groups are saying, I disagree that these success factors is being met. Or you will also find situations where you have a group of people who are agreeing that these indicators are being met, but others will answer that they disagree with this. So they have not a consensus on where you are. So this is the type of problems that you will be identified through this questionnaire. And by organizing a workshop to analyze this questionnaire, you will on one side develop a common understanding of the situation or where you are in your readiness to deploy, and also you will be able to derive an action plan for preparing the deployment or for organizing the next step of the deployment. And I believe that with this, I have provided you with enough details or enough element to understand that with a tool like this one, you will be eHealth professionals will be able to mind the gap when moving from pilot to routine care. We have tested that workshop, that blueprint twice. We have organized, and that's the testimonials, we have organized workshops in 2 countries, in Norway and in Scotland, in the UK, with steering boards. We have organized workshops, questionnaires, and workshops on the basis of this momentum blueprint to help these steering committees to assess how far they are. And believe me, this methodology, this critical system, and this methodology has helped them to define what's next in their action plan. And I'm closing with this. And sorry, I've been a bit longer than expected, but I will be delighted to answer questions. And you have here the URL of the website of the project, and you have my contact details, and I will be delighted to answer any questions that may pop up on your side. I thank you for your attention. Bye.
Thank you very much, Marc, for that very comprehensive session on telemedicine. I believe most of us here in this meeting room have telemedicine in the core of their work. So we have a number of questions in our chat box. So I hope that we could answer, that Marc, our speaker, could answer this very briefly. From Dr. Jayatri Wiyaratne from the Ministry of Health in Sri Lanka. Sri Lanka delivers its health care mostly free to the general public when delivering telehealth concept to this model. Are there any examples from such a country where we can get advice on change management, business plan, and cost-benefit analysis?
That's a hard question. So, first of all, in Europe, healthcare is being provided as a universal service to every citizen in different mechanisms, but that's not important here. But it's provided for free, not on a commercial basis. So that's important to keep in mind. It's provided for free, even if often or always, or in most of the case, patients are being asked to contribute, but for a small amount, to contribute to the cost of the care. This is just to avoid abuse in the healthcare delivery. But so we are here in Europe. We are here in a universal healthcare delivery environment. Now, providing advice on change management, on business models, and so on, when dealing with telehealth, you need to be aware that we are here in a really new field, in an emerging field. So there is little experience here and there. Israel is one of these examples, but there is little experience on how a country, on how a region on a large scale has been running this. Everyone is aware of this. Everyone is important when you are attending conferences in Europe on these topics. This is mentioned as a very important topic that we need to pay attention to, but we are whole, most in Europe, we are mainly more in the context of learning by doing on this.
Okay.
I hope I understand, I have answered the question.
Right. For those who are hearing us in this meeting room, you can raise your hand if you have a follow-up question or you want to ask your question via voice. Here's another question from India, from J. Ganesh Udayasankaran. Was there a formative evaluation after program has been established? And is there a means to periodically review the utilization and enlist the feedback from the users for enhancing or refining the scale and scope of services?
Okay. That's an interesting question. So, formative evaluation of telehealth, of the service. Again, here we are in a learning by doing context. What I mean here is that in Europe, when you are asking academics, when you are asking scientific people to evaluate a service in healthcare or a system in healthcare, they are running they are using the randomized control trial as a technique for evaluation. The fact is that indeed today we have demonstrated, there is a proof now, there is a demonstration that for telehealth, for eHealth, this kind of evaluation does not work, or does. Renewing Health has been using that method of randomized control trial. This kind of evaluation does not work with telehealth for a number of reasons, and I will not detail them now. And instead, we need to go for formative evaluation. But this is a brand new message, a brand new conclusion that we are learning now, and that the project United for Health is learning now. That formative evaluation, meaning that implementing telehealth, adapting the organization to optimize the use of telehealth and transforming the organization, and then evaluating the transformation, refining the organization of the care process based on the outcome of this evaluation, in order to go for a next iteration of the service, and then permanently evaluating the population that is in scope of the service, that is benefiting from the service, and so on. This is the very lessons that United for Health is learning now from the project, which is creating a problem, because a number of decision makers were of the opinion that scientific evidence on telehealth is necessary before going launch, to deploy telehealth, and now they are discovering that this scientific evaluation using the classical randomized controlled trial doesn't work. It provides some part of the answer, but not the total part of the answer, and that only formative evaluation will contribute, will help. And they need, and all politicians in Europe, they need now to learn that lessons, and they need now to understand what it means, and they need now to accept that that message before going further.
All right, there's really a lot to learn in terms of evaluating eHealth systems. We go now to the question of, again, from the Ministry of Health of Sri Lanka, from Dr. Pamod Amarakun. Thank you very much for the nice presentation. Since telemedicine involves significant number of resources, what is the usual method deployed in Europe for funding these resources? What is the involvement of the government and other agencies?
We need to make a distinction between resources for the pilot phase, for the project phase, for the deployment phase itself, and then the resources for the operation phase. For the moment, at operational level, the idea is that the healthcare systems of Europe should consider that healthcare provided with telehealth is reimbursed or is covered or is financed on the same way that healthcare provided without telehealth. This is, however, again, a big discussion. There is not yet, there is only very little examples on that situation across Europe because of the efficiency, of the economic efficiency of telehealth has not been demonstrated yet, or is in the process only of being demonstrated. So again here, this is something that is in movement. Now, in terms of funding the deployment phase, there is a number of there are financing program at European level and at national level for financing innovation, for financing innovation in healthcare. Most of the time, this is the way projects are being funded. Now, we also have observed that there is a number of private companies who are also deploying telehealth or creating telehealth services on a commercial basis, and then this is being deployed like any other private business. So examples like this also exist, but that is, of course, then private financing and not public financing.
All right. So I think the models depend on what resources should be used.
Yes.
Okay. All right. So here's a question from there's really a lot of questions in my Q&A box, and I will try my best to cover this within our session for tonight. From Mr. Vince Tumlos of the Philippines, from Europe experience, what convinced or guarantee private organizations to engage in the pilot and scale deployment in terms of technical and financial resources?
How should I answer that? To me, there is no guarantee. This is always, for the private company, this is always a, well, we need to distinguish. Private companies for deploying services, telehealth services itself. There is no guarantee. This is like developing any business. It's an adventure. And the government today is not in position, is not ready to support this kind of development. They are definitely not against, but they consider that it is the private sector to take the risk of this. Now, you have also private companies have also another role to play in providing the technology, and here we are exactly at the point. At the point where there is not yet guaranteed, but well, it's not yet. There is not a guarantee, but there is something happening here, and this is the discussion of the scaling. So the more countries, the more regions in Europe are making the decision to scale to deploy on a large scale basis the technology, and you have that happening in a number of countries, in the Scandinavian countries, but in Scotland, in some regions in Italy, in some region in Spain, for instance. The more regions, the more public authorities are launching large-scale deployment program, the more the market will grow, and the more, of course, the private sector will get guaranteed to sell their technology. So we are here really at a point where the market is preparing its growth.
All right. Another question from India. What is the government structure for this program, especially since it encompasses multiple countries in EU? So we have been talking about private and public ownership, and I mean, how do these? Public and private roles within telemedicine. So in Momentum, what is the government structure of this program?
Okay, I understand. I think I understand the question, and I think that that question, my answer will also be valid for the other project that I've been referring to, for Renewing Health and United for Health. These projects are examples of projects financed by the European Union as research and innovation projects. How does it work? There is a call for proposals, which is on a regular basis a competitive call for proposals, where the European Commission, the European Union is asking for submission for consortia of different organizations submitting proposals on different teams and fulfilling different conditions. This is a competitive process. You have consortia which are now being created, combining public organizations, private organizations, organizations like EHTEL, sometimes companies, sometimes the industry. So this is own initiative of public and private organizations who says, we will submit a proposal, we will create a consortium in order to get in order to win that proposal under the leadership of a coordinator, and that coordinator will then be coordinating. So will put in place the necessary governance for the project to function. So with steering committee, with the different project management infrastructure that is to be put in place, and then once it is in place, once a proposal is adopted, is elected, selected and financed, once the project is running, then the European Union will transfer step by step the funding to the coordinator, for the coordinator to distribute to the different organizations to cover the cost of the project itself. So it is a project governance that is being put in place.
All right. So I think we've learned a lot for tonight, and we hope that we will be able to answer more of the questions listed. But for the interest of the time, and 18 hours is just a single hour, we will be sending all your questions to Mr. Marc Lange via email, and we will be sending the answers to that questions via our email feedback to you. So before we end our sessions, any final words, Mr. Lange, for our webinar participants tonight as regards to adopting the critical success factors to implement a good health system?
Yes, one final word. These critical success factors, this is not rocket science. They are generic, and they are expressed in generic terms, and they are to be used only as a starting point or as a method for each of the e-health professionals, each of the doers, it's just a starting point for developing their own critical success factors, for adapting them, for rewording them in order to match the special conditions, the requirements of the fields and of the place where you want to deploy the service. So there is no risk. Everyone, there is no risk, or there is no reason not to adapt these success factors. They only have the ambition to be a starting point and to be a platform for collaborative work and a starting point for everyone. So they are, from that perspective, they are very flexible. And I would be, and last but not least, I would be delighted to hear from any experience on in using these critical success factors. And likewise, I will also be delighted to find means, to find mechanisms to provide you with, or to coach, or to provide some support to those who are willing to, who are interested in using them in their own practical projects. And it has been a great pleasure, although I could not see anyone, but it has been a great pleasure for me to make this presentation and to hear the questions that I received, which are all of high quality, and which are all demonstrating not only the interest but also the quality of the audience I have been speaking today. So it has been a big pleasure. Thanks a lot for this.
You're welcome, and it's a very great hour with you, Mr. Marc Lange. Thanks all to those who attended our session. We have participants from the Philippines, Japan, Fiji, Sri Lanka, Laos, Thailand, Cambodia, Myanmar, and Malaysia. And on July 25, we will be having another AHIN hour back to our 4 p.m. Manila time slot. Our topic will be on SS Mix, Japan Ministry's Standardized Storage and Application. I'd like to invite you again to register for this webinar so that you will learn more about our speaker, Dr. Michio Kimura, and more about what happened in 1995 earthquake and how the SS Mix standardized storage was developed to improve healthcare in Japan. Thank you very much, and see you on July 25. Thanks also to our speaker, Marc.
Thank you.